Today, we're going to be discussing and understanding the stem cell therapy and cutting through the hype, the Venturis approach to regenerative healing. Venturis has been in business for over 25 years, and we're always looking to be the leader in providing quality service and healing for our patients. The stem cell therapy landscape has changed over the years. Stem cells are definitely revolutionizing medicine. Are commonly treated conditions, joint pain, autoimmune issues, aging, chronic injury, or just to name a few. And recently, after COVID, we've experienced a multitude of weird symptoms popping up, and we're utilizing these diagnostic tools and treatments like stem cell for therapies. Various types of regenerative therapies include the standard PRP, which is where you take someone's blood, you spin it, and you focus on the platelets to accelerate healing. PRP Matrix, which is a newer type, a more advanced type of PRP, and that is where we actually take ozone, mix it with PRP and possibly some peptides, and that matrix will allow people to heal faster. Prolozone is a combination of regenerative mixture using collagen, peptides, and ozone, and we use it for various types of connective tissue types of damage. Exosomes are recently very popular, and although we've been doing it for decades, we've kind of taken a step back on some of the exosomes. Those are more of your signal carriers, but they're not actually stem cells. So the signal carriers are what allows a lot of the inflammation stuff to go down. But we really kind of lean into more of the VSELs, which are the very small embryonic type cells. These are not aborted babies, contrary to what people are saying and stuff. These are actual stem cells donated by moms for research and for these type of treatments. And they're clean, they're healthy, there's nobody's DNA in there. And we combine that with things like NAD plus and laser. Now, bone marrow is also very common now compared to what it used to be, but it's invasive, and your declining stem cell count as you get older makes the success rate of bone marrow stem cells low. Our preferred approach of Venturis is to use PRP Matrix, Prolozone, and VSELs. We avoid bone marrow and unregulated exosomes. All the therapies are safe, legal, and clinically backed. Along with that, we actually like using the power of the Weber laser needle. It stimulates mitochondria, boosts ATP production, which is your energy for your cells, accelerates cellular repair, reduces inflammation, and it's definitely non-invasive compared to surgery and no downtime. This is why you don't need to travel abroad. There's a lot of hype behind that. There's risk of going overseas. It's unregulated biologics, inflated costs, and it's a lack of follow-up because there's no such thing as one injection and all of a sudden you have a new knee. These treatments take time and possible multiple treatments, but we offer very safe and affordable and effective care right here in the U.S. Experience matters. With over 25 years in regenerative medicine, our team includes MDs, chiropractors, and naturopaths with personalized care with proven results. Patient-centered healing, because we actually look for the root cause of the diagnostics. Even if you have MRIs and stuff, we want to make sure we know what we're dealing with and why none of your other treatments have worked. And then using advanced regenerative tools, we can go into more ongoing care and education, and we will definitely show you some testimonials and outcomes after your visit. So what to expect from treatment is we usually start with a consultation, proper diagnostics. We will talk about PRP and VSELs and figure out how much you need, if you need it, because some other options are to stick with Prolozone and other treatments that get pretty close to the same results. And so if you can avoid stem cell, we usually will make that recommendation for you. And you can also do it in injection or IV therapy. The laser application is there, and there's also supportive care and monitoring. So you're able to come in routinely, maybe every 6 months to a year for maintenance or some sort of monitoring. So take action today. No need to travel overseas. Call Venturis Clinic for a personal consultation, 405-848-7246, venturisclinic.com, or visit us at Instagram at Venturis Clinic.